All right, thanks for listening to NYSEA Radio. You can find us on Apple, Spotify, iHeartRadio, Google Podcasts, any of many platforms, whatever is your desired platform to listen to us. We really appreciate it. We have a great show today. Special guest, Dr. Wayne Weil from the Orthopedic Specialist of Seattle. You can also check him out at SeattleHandSurgeon.com. He's known in the community for his expertise in hand surgery, a wide variety of hand ailments, and a bunch of other things. And more importantly, for today's show, he has published several scientific papers and presented his research in the field of trauma. And that's what we're going to talk about, because we saw a lot of trauma this past weekend, what happened at the Cowboys and Giants game. But before we get into that, Dr. Weil, welcome, and thanks for taking some time to join us today.
Thanks for having me.
Dr. Weil, the game started out innocently enough. Two NFC East teams were playing. One of them is bad, and the other one is really bad. And we saw a common football play, a play that you'll see throughout the game numerous times. And, you know, week in and week out, a quarterback rolls out, cornerback comes up on him, makes the tackle, and then what any fan, no matter who you're a fan of, whatever team it is, you see a traumatic injury right away. Dak Prescott goes down, and he's diagnosed with a compound fracture and dislocation of his right ankle. You can see the pain. You can see the agony. You can see the people on the field react. You can see them calling for coaches. First off, explain what a compound fracture and dislocation of his right ankle, what that means, and I want to get into some other things.
Sure. So compound fracture essentially means an open fracture, which basically means that when the bone breaks, that it comes out of the skin. So you have bone that's exposed to outside of the body and exposed to the elements. And so compound fractures are a fairly severe injury in that not only do you have to deal with a bone being broken, but also now the potential for infection as it's now exposed to that outside environment, and it greatly increases the risks of infection, as also it affects the ability for the bone to heal. So you have much higher rates of what we call delayed unions or non-unions, meaning that the bone may not necessarily heal when compared to a similar fracture where the bone doesn't come out of the skin. And then a dislocation is basically whether it's an ankle or your shoulder or hip or elbow, the joint itself pops out. So commonly in the shoulder is probably the most commonly dislocated joint. The ball and socket become disrupted, and the ball comes out of the socket and then has to be either pushed back in by the trainers or the doctors, or it pops back in on its own. So Dak Prescott's injury is quite severe in that it's an open fracture or compound fracture where the bone comes out of the skin. It's also a dislocation, which oftentimes means a lot of the ligaments that hold the joint together are torn. And then obviously the fracture itself. So he's essentially got three strikes against him in terms of it's a dislocation, it's an open fracture, and it's a fracture itself. So very severe injury.
What's the most important thing for whether it's the team doctor or any doctor from either side that's closest to him? What's the most important thing that they can do at that moment to try to help a terrible situation?
Yeah, so the first thing immediately that you want to do is with the dislocation, you want to try and get the joint back into place. What happens with the dislocation is the cartilage, the smooth gliding surfaces of the joint, when they're dislocated, basically are immediately stressed in terms of not having their normal architecture and normal fitting of the joint. So you're abnormally loading that cartilage, and you can put big divots in it, and just simply having pressure on the cartilage in an abnormal way can cause damage to it, and basically long-term damage to cartilage leads to an arthritic joint. So really the first step is right away put the joint back into place. We call that reducing the joint, especially in ankles where the skin is pretty thin. Basically, if you feel your ankles, it's just skin and then bone is right there. You don't have a lot of muscle that's covering that area. And so if you leave the joint out of place, it also is shearing the skin. And if you don't have an already open fracture like Dak Prescott had, but just simply a closed injury, but you left the joint out of alignment, the skin can break down and create an ulcer, and it can become an open fracture. So really first step on the field, oftentimes you can reduce the dislocation, and then you want to put on a splint. In the NFL, they have access to pretty sophisticated splints. You can see the trainers actually on the field pumping the splint up. So it's basically an air cast. So that helps stabilize the fracture, which provides some modicum of relief of the pain, because obviously the bone's not flopping around. You could see on the video after he broke his leg how his leg was just kind of twisting in the wind.
Oh, man.
And that's obviously incredibly painful. So step number one, reduce the dislocation. Step number two, put on a splint. And those are really the on-field things that you do right away.
So let me get this straight. So you have a compound fracture, you have a dislocation, the doctor's coming over and now is trying to relieve the dislocation of the aspect of it first before they're even trying to deal with the compound fracture. Is that correct?
Correct. So you reduce that joint, get it stabilized, because the treatment for the compound fracture, that's really in the operating room. You have an open laceration, you got to wash it out and then stabilize the bone with surgery, whether it's plates and screws or a rod, depending on the fracture pattern. That comes next. But certainly the first step is just, kind of battlefield medicine, where you just stabilize the injury so you can transport the patient in a somewhat comfortable way to the hospital.
None of this sounds comfortable. I just want to let you know, Doc. None of this sounds comfortable at all. You're telling me that he is in complete pain with his fracture, and now I'm going to snap your ankle back into place. Okay. That is something else.
You'd be surprised, Will. Having the bone or the joint itself out of the socket, whether it's your ankle or your shoulder or any joint, that in and of itself is incredibly painful. When you maneuver the joint back into place, pretty immediately the pain is significantly reduced. And so before you even on the field, if you can get a joint reduced, you can obviate a lot of the need for pain medicine just by getting the joint back in.
Gotcha. So this is considered a traumatic injury, correct?
Yeah, absolutely.
So can you explain to our listeners what is a traumatic injury? What is trauma? And what are the levels of trauma when it comes down to injuries like this, or whether it's a car crash or anything like that? What is trauma?
Yeah, so trauma in and of itself is basically force being transmitted to our bodies. You can have trauma from a knife wound that creates, a laceration. down to, on the other end of the spectrum, blunt force trauma. Somebody gets hit by a train and, gets crushed. So, you can have sharp trauma or blunt trauma, but essentially what is happening is tissue disruption due to the forces applied to it. And those tissues can be skin, they can be bone, they can be ligament, they can be muscle, and then as well, our internal organs.
It's a shame. We were talking before we started the show, and we talked about Dak Prescott and the injury that he sustained. And at the same time, a quarterback from one of your football teams that you enjoy to watch in Washington, Alex Smith, made his return. And it's just so unfortunate that on the same day that he comes back, he came back to play football this past weekend versus the Rams after almost 2 years. And, he replaced Kyle Allen. Kyle Allen, I believe he sustained a concussion, or at least had concussion symptoms, as the way they described it on television. And he came into the game. And in fact, I was watching the game. I was doing some things around the house, and he came into the game. And I got to be honest with you, I was like, oh, God, please. Please don't let me see anything crazy on the field. It's been documented. I'm not sure if you saw the document on ESPN when they followed him around and talked about his
Project 11.
Oh my Lord! And when he came in to play, it was just, please God. I was thinking about him. I was thinking about his wife. I was thinking about his kids. But still, for him to come back and get back to where he was, at least on the field, whether he's productive or not, I think that's secondary. How amazing is that for Alex Smith to get back on the field after sustaining really such a nasty, nasty injury to his leg?
It's truly inspirational, I think. It really is, to me, mind-boggling that he is able to compete as a professional athlete at the highest levels of sports after the injury that he sustained and what he went through over those 2 years. I think he had about 17 surgeries on his leg.
Yes, correct, 17.
We were talking earlier, you asked me about trauma, and I actually kind of gave trauma a bit of a short shrift in that, I talked about the physical side of it, but the mental side of trauma and injury in a lot of ways is just as devastating for people. Certainly, in the immediate part after an injury, you could see Dak Prescott on the field. He was visibly upset, in pain, obviously, but also just upset of what happened and very emotional. And so you have this wild swing in terms of emotions after a traumatic event. First is the why me? And oftentimes very common for people to have bouts of depression. And then, you take the long road back in terms of recovery. And part of that is physical and going through all the pain of rehab and physical therapy. But the mental side of it is just as important in terms of overcoming the initial bouts of depression that people have and getting back into a positive attitude that, you're going to overcome this obstacle that's been placed on you. And then not only that, but then having the confidence in your leg or your arm or whatever body part was injured to perform, like it used to. It's a whole swing of emotional recovery as well. And I tell my patients all the time, you are not fully recovered until you tell me, I don't think about my leg or my arm or my hand anymore. It feels normal and I don't think about it. And that can oftentimes take a lot longer than the physical side of it.
We saw it with Dak Prescott this past weekend. We saw his teammates. We saw the football family, the football community, really just devastated. I mean, Logan Ryan, he's the one that made the hit on him from the Giants. I mean, he was absolutely devastated. Joe Judge from the Giants, Logan, and really everybody. Daniel Jones. The first thing they said in the press conference was, prayers and respect to Dak Prescott, what a great player he is. And you could just visibly see on the field where people just shaking their heads, they're taking knees. And that's not even what the player's going through, but how it affects everyone else in the community. And then, to line up, when the ref is saying, okay, we're putting the ball back down, let's get back out there and hit somebody. I mean, that toll itself has got to be something that must be so difficult for a player on the field to kind of say, okay, I got to go out there and play football. We're still in the game.
Yeah, absolutely. I mean, huge swing of emotions. Football, it's a violent game, but nobody on that football field wants to hurt anybody and wants to, create a career-ending injury.
Yep.
They want to. Pro football players, they know the deal, and they know that it's a violent game and they're big hits, but no one's interested in breaking somebody's leg. That's not what they're all about, and they all know it could just as easily be them that's in that position. While we were preparing for this, I looked back at the videos from when Joe Theismann got hurt, and Lawrence Taylor back in the day, most feared guy in the NFL. And you can see right when he got up and realized what had happened to Theismann's leg, he was the first guy, screaming for the docs to come over to help out Joe Theismann, and visibly upset by it. Same with J.J. Watt. When you hear the interviews from J.J. Watt when the play with Alex Smith happened. Very, very upset with it, and nobody wants that.
Let's talk about advancement and treatment. That was the Theismann injury was in 1985. He suffered a compound fracture of the tibia and the fibula in his right leg, and pretty much that was the end of his career. He did try to make a comeback. In fact, I believe he tried to make a comeback with Washington first before he went to the other team. It might have been the Rams. I'm not exactly sure. And he said that he was finally ready to play, but he never made it back on the field. The way the treatments are from 1985 to now in 2020, what are some of the major differences that you can kind of pinpoint to say this is what has been done going forward from the time of the injury? Because I remember that Theismann said they were just pouring water over his leg trying to keep the bacteria from seeping in. I mean, I can't imagine people pouring water on my leg until he got some kind of treatment. So what are some of the differences when it comes to a major injury like that on the field?
Yeah, so our understanding of these devastating wounds is a lot better. We have much better wound treatments in terms of we don't just put gauze bandages on and hope for the best. We have pretty advanced bandaging techniques now where the bandages are impregnated with different antibiotic solutions. We use very commonly now as well, it's called negative pressure therapy, where basically the bandages are sponges that are connected to a suction device, and it can pull fluid out of these wounds and keep them much better protected. We, in terms of the fracture fixation that we use, the hardware itself, the plates and screws are just designed a lot better now that we have really good 3D modeling of bone. We have implants that are pre-contoured so they match the shape of what normal bone is. We oftentimes now we use titanium implants, and titanium it's a great material for orthopedic implants because it's a very light and durable and strong material. And then our understanding of muscle regeneration and nerve transfers, as well as wound coverage, something called a free flap, where if you noticed, if you've watched the documentary on Alex Smith, they had to transfer some muscle to get coverage over his wounds. You can connect arteries from a donor muscle to the recipient site to get blood flow back into an area. So we've had a tremendous improvement in terms of the way we handle wounds, from 1985 to present day.
If Alex Smith would have got hurt in 1985 and had that infection, what do you think would have happened to his leg?
Oh, yeah, definitely he would have had an amputation. If not, he may have lost his life. In the documentary, they talk about that he had necrotizing fasciitis, the flesh-eating bacteria, as it's commonly known, and that's a surgical emergency. People can rapidly decompensate in terms of blood pressure and fevers, and that is a life-threatening illness. And the fact that he is playing in the NFL today, to me, is a miracle. It's really incredible.
It was scary as a fan to see him on the field. And I think next week when I see him again, I'm probably going to be afraid again. And that's just, I guess that's just me. And I know most people are not going to be worried about stuff like that. Maybe it's the parent in me, just thinking about if my kid was out there and knowing, he got cut open 17 times and had this infection and everything that he went through. And he's made almost $200 million. He has a beautiful wife and wonderful kids and everything that's a part of it. When Aaron Donald, I'm not sure if you saw the play, he went and sacked Alex Smith. He was pretty much piggyback riding and on top of him, and I was like, please get off this man. Just please, can you sack him? Can you get him down? Can you lay him down gently? I do not want to see something happen to this man and his leg, because him and his family has been through so much. And I guess my point here, which is taking a while to get to, is what do you tell, as a doctor, what do you tell a patient that has experienced trauma? What is your role as a doctor to make sure that they're going to be out all right as soon as they leave? Do you have to consult with therapists? Is your job to kind of point them in a certain direction for mental and emotional stability throughout this traumatic experience?
Yeah, absolutely. I tell my patients all the time, this is a team game, and the patient and their family is ultimately the quarterback or the head coach. They're the ones who ultimately have to make those hard decisions. My job is to give the patients, all the information about the different options available to them, and then help coordinate and make sure that the decisions that they make are, in fact, followed through upon. And so, you take someone like Alex Smith, again, we keep going back to him, but he's a great case study. In that documentary, they ask the team physician for the Washington football team, what would you have done? And she says, I would have had an amputation. And so, they had that conversation with him, and he, clearly chose the path of having his leg saved and going through everything that he went through. And so there's tremendous coordination with the care team, whether that's the medical doctors just treating the infection, with the physical therapists, with coaches, with family, and ultimately, the doctor's job, I think, is really to facilitate the recovery that the patient desires, within the bounds of reasonableness. And I can't take you or me and make us into NFL quarterbacks. That's never going to happen because we just weren't given those gifts. But someone like him, if he's willing to put in the work and willing to suffer, which I'm sure he suffered and his family suffered for those 2 years, you can accomplish amazing things. But the surgeries are, I think, the easy part in all of this. I tell patients all the time, you're going to be asleep. This is the surgery. That's easy. It's the recovery that's the tough part, and it's going to be tough on you and your family. It takes tremendous coordination with everybody involved, and we're just a small cog in the whole machine.
It's amazing, absolutely amazing, and I can't agree with you more about Alex Smith. I think he just has a combination of his faith, his work ethic, and his belief, and also having that support system at home. I mean, his wife, Elizabeth, she talked about her fears and everything else, and then she said, it pretty much came down to, I'm going to quote here, knowing how much an injury like this can affect a person mentally, physically, and emotionally. For Alex to overcome that and get himself back to the point where he can be bigger than any of this is amazing. And that's just it takes a lot to get back at that point. For Dak Prescott, I guess there's some concerns off the field, right? Because it's been documented this year that there's been some mental health issues. He's had some loss in his family this year. He's been outward about those concerns, outward about his mental health, and now this has happened to him, and we know that this is going to be a long road to recovery. If you're his doctor and you know that this is a pattern, what are some of your concerns with a patient like this, and how can you go about trying to, I don't know, whether it's keeping tabs on him or keeping an eye on him, or what the prognosis is for his mental stability going through something traumatic?
Absolutely. It's a huge challenge for him. I think the single best thing he has going for him is that he's been honest and open about those challenges. Mental illness has such a stigma associated with it, and it's fine for somebody to have a broken leg, but it's not fine for somebody to be depressed, and that's really not okay.
Yeah.
So I think number one, he's open and honest about it, and that's a huge step in the right direction. He's going to have a tough road ahead of him. He just missed out on, playing the sport he loves, and the competitive fires in him, will, I think, ultimately bring him back, but there'll be some struggles ahead. Certainly, you saw on Twitter his brother was at his side, at the hospital. So I think, having a strong friends and family support system is huge. This is the time when you need those people who are close to you to rally around you, and feeling like, you're not in this by yourself is tremendous, and tremendously helpful for patients' well-being. And then, absolutely being in tune with this as the treating physician, and knowing that, somebody who has had some mental illness challenges in the past, that to be aware of those, really be in tune when you're seeing these patients in the office, and making sure that they are responding appropriately. One of the big challenges we have these days is issues with dependence on opioids and pain medication.
Yeah, good point.
And so that will be certainly something that we'll keep an eye on, and be very vigilant about trying to get people off of the pain medications as quickly as possible. So there's a whole host of things out there, but again, it really comes back to sort of this, I think, the team mentality, friends, family, physicians, therapists, everyone just being in tune with what's going on with the patient, and constantly checking in and making sure that people are doing okay mentally.
What responsibility, or I guess maybe what communication would the doctor, his surgeon, would have with the team doctor, right? Because, as we know, this is a business and there is an investment in this player. What is their communication, and what happens, once the surgery is over? Because we heard that he has surgery, I believe, right away, right? I think it was Sunday night he had surgery, and he was already home Monday. That's amazing to me. I can't even wrap my head around going, having the injury, going in for surgery, and back home.
Yeah, it's pretty incredible how quickly you can bounce back from an injury like that in just the acute care. It's once you get the bone stabilized and come out of surgery, barring anything terrible like what happened to Alex Smith, there's really not a huge need to actually be in the hospital. And being at home oftentimes is much better for people's mental health. Oftentimes, as a team doc, your specialty may be, soft tissue, sports medicine type stuff, like, the classic one is ACL tears or those sorts of injuries. With an injury like Dak Prescott, you'll consult orthopedic colleagues whose specialization is more either foot and ankle or trauma surgery. And then, so as a treating physician, clearly your first responsibility is to the patient. First and foremost, they're your patient, and whether or not there's financial considerations involved in their outcome, really doesn't matter. That being said, the pro sports, it's a business. As a patient, there are rights to privacy, and certainly before communicating with team physicians and owners, patient has to give consent for that. So, Dak Prescott, I'm sure, is going to be talking with his team docs and Jerry Jones, and he will allow for communications between his surgeons and the team. But as long as he's giving consent for those communications to happen, then it's okay for that to happen. And the docs will all be talking and coordinating care, and they'll be setting up his rehab schedule. And ultimately, the goal is to get him back playing next season.
Oh, that's absolutely amazing to think about that. There's a possibility that he might get out there. And I guess maybe, not to minimize it, but I guess being a quarterback is different than being a basketball player, like a Gordon Hayward or Paul George or Kevin Ware when with Louisville, one of the nastiest injuries I've seen.
Oh, yeah.
He had that with the compound fracture of the tibia above the knee, which whatever, that was just craziness. So just compared to a basketball player that have had these injuries, I know Gordon Hayward's taken some time to really look like himself, and he still has it. What's the difference between that basketball type of player that has to use the explosiveness and moving around compared to a quarterback, even though he relies on his legs, but he could change his style a little bit? What's the differences as far as recovery and getting back on the field as a sports fan?
Yeah, so with these types of injuries, the biggest thing that people will, and especially the pro athletes, is they do lose a little bit of that explosiveness or their ability to just have that millisecond of fast twitch muscle function that gets them to jump just a little bit higher than anybody else or run just a little bit faster. A professional quarterback, you can alter your style. Not everybody has to be a Michael Vick type of quarterback. You can be more of a pocket passer and have that awareness of where the rush is coming from. You don't need to potentially run as quickly or jump as fast as a pro quarterback. You obviously still need your arm. You got to be able to throw the ball, 40 to 60 yards downfield accurately. Whereas a basketball player, basketball is all about those quick, explosive moves where you're jumping and cutting and spinning at a much faster rate than a quarterback is. So it is harder, I think, for a pro basketball player to come back from that type of injury than a pro quarterback.
Dr. Wayne Weil, orthopedic specialist of Seattle. Please look him up at seattlehandsurgeon.com. I really appreciate your time today and spending some time with us. We didn't even get into our beloved Yankees, how they've another season has gone by without getting to the promised land. And as a Yankee fan, that's all that matters.
Well, thanks a lot, Will. It's really been a pleasure speaking with you today on the podcast. It's been a lot of fun. I hope to do it again sometime.
Anytime. It was a pleasure, and thank you for scaring the daylights out of us talking about all the craziness when it comes down to these fractures and trauma. So we really appreciate it, and I hope our audience got some really great information today.
Thank you very much.
All right, you take care, man. Appreciate your time, Dr. Wayne Weil.
All right, thank you.
Take care. That was Dr. Wayne Weil, orthopedic specialist of Seattle, seattlehandsurgeon.com. He's a board-certified orthopedic surgeon, has plenty of experience with whether it's hand surgery, published several scientific papers in the field of trauma. Just a great person to get great information. I hope everyone got a lot of information today. I know I did. And now I will gingerly walk somewhere because I do not want to have a traumatic experience. Even though I had my Achilles snapped playing basketball, weekend warriors, what these athletes go through and the type of injuries that they sustain at the level they do, at the speed, the size of these players in the NFL or NBA, it's so traumatic. And we talked about it today, the physical, the mental and emotional aspect that you must go through when you sustain these injuries, and having the support system that you do really matters. So we really appreciate his time today. Thanks for listening to NYC. NYSEA Radio. Be sure to catch us on Apple, Spotify, iHeart, SoundCloud, Google Podcasts, many others. I'm Will Sanchez. We're out.